Welcome back to Sports Night Oklahoma. We're going to talk about injuries, specifically to the anterior cruciate ligament that happens to so many athletes in various sports across the country these days. And to do that is Tony Jabbour, Dr. Tony Jabbour from Tulsa Bone and Joint. And let's first off talk about this injury and how treatments have changed over the years and how being able to identify that specific injury has changed over the years.
Yeah, Mike, I mean, I know you talked about anterior cruciate ligament injuries occurring in all sports. I mean, it can happen with most sports, but the high demand sports such as football, which is happening right now, and through basketball and snow skiing as well as water skiing, those are high demand sports activities where we can see these anterior cruciate ligament injuries.
Okay, and you talked about the treatment over since the 60s and 70s. Now you see someone gets out of surgery, they can recover a lot quicker. You make a smaller scope and things like that.
I mean, that's definitely true. I mean, in the old days, we're talking old days meaning 60s, 70s, and even very, very early 80s, patients ended up with these huge long incisions over their knees, and the doctors at that time used to put them in these big braces or casts for anywhere from 2 to 3 months, and these athletes would have a really difficult time regaining range of motion, and it was difficult for them to return to sports.
Okay.
What we do now is much smaller incisions. We say it's arthroscopically assisted. Okay. So it means we make tiny poke holes as well as small tiny incisions to be able to do the same surgery they did back then, and our success rates are better than 95%.
If someone has injured themselves, whether it be in a pickup game or like us out trying to play basketball or whatever it may be, or an athlete in a high school football game, you guys are kind of a one-stop shop. They can come to Tulsa Bone and Joint and get everything taken care of, from predetermining what the problem is to all the way to rehab.
That's correct. I mean, right now during football season, with high school football, being really hot right now, I mean, we get to see that athletes right there on the field. They get injured. We're able to evaluate them before their knee swells, and that makes it easier for us to really know what's going on. But then we basically bring them back to the office over the next few days. We're able to do x-rays. We're also at Tulsa Bone and Joint. We're able to do their MRIs right then and there as well. And their surgery's done there as well. We have Union Pine Surgery Center right there. And then after their surgery, they get to have their their rehab done, through the Platinum Gym that's connected to us, and also they get their braces. Also, if they need them to go back to playing sports, we can order all that right then and there, one place, the Tulsa Bone and Joint.
What are some of the other common injuries that you guys come across, especially this time of the year?
We see all sorts of things. Shoulder injuries are really big. Those are other injuries that we take care of surgically quite often. But Tulsa Bone and Joint would take care of all injuries, whether it's a hand injury or a foot and ankle injury or a knee or shoulder problem. We basically get these athletes to the doctors or surgeons that deal with this most often. So, I mean, you don't want someone to treat you if they only do something once a year. Right. You want somebody who does something several hundred times a year, and that's how we're able to get these athletes back to playing quickly.
What are some of the other important factors like that that folks that are potential patients need to take into consideration when they're looking for a place or looking for a doctor to take care of their injury?
Correct. I mean, one of the main things, you got to make sure that, especially if it's an orthopedic surgeon that's taking care of you, that they are board certified or board eligible, meaning that they've qualified and they've taken all the appropriate tests to make them a good orthopedic surgeon. Right. And specifically for sports injuries, if you have someone that is fellowship trained in sports medicine, that also gives them a little bit of additional qualification to basically treat an anterior cruciate ligament. Okay,
Tulsa Bone and Joint, located at 4802 South 109th East Avenue in Tulsa, 392-1511 the number, tulsaboneandjoint.com is the website. Dr. Tony Jabbour, thanks so much for your insight.
Thank you.
All right, we're going to have the O'Connell's post-game report when Sports Night Oklahoma continues.